So this is the table of intent. These all points we are going to discuss in the slide. First is introduction to social pharmacy. Next, we'll go through the scopes of social pharmacy, role of pharmacists in public health, various dimensions of health, determinants of health, indicator of health, Millennium Development Goals, and at last, Sustainable Development Goals. So, social pharmacy. Social pharmacy is defined as a science which deals with the social aspect of the profession of pharmacy. Sociology refers to a behavior as a form of social action, an action that is influenced by society and also influence the society. Social pharmacy reflects that pharmacy practice does not simply involve medicine and advice to public who take their medicines and follow expert advice without question. Rather, it is the practice which involves both the pharmacist and public, where both interact as social individuals, as interdependent members of the society. Moving on to the next slide. Scopes of social pharmacy. So as I discussed earlier in the earlier slide, social pharmacy is basically the part of it is a subject taught in the diploma of pharmacy first year. So here we read about what are the social aspects of pharmacy other than dispensing medicines, other than talking about the drugs, what all other aspects does pharmacy subject consist of. Now, so what is the scope of pharmacy in improving public health? So the first scope is health financing. In an effort to protect a vulnerable population from financial problems, pharmacists ensure the provision of cost-effective healthcare through logical use of medical products and modern technologies. Majority of published service studies have demonstrated the value of pharmacists in substantially increasing healthcare savings across various settings, attributing such result to pharmacists' expertise in reducing and preventing medication related problems and in providing cheaper alternatives or suggesting medicines that are covered by insurance. Next scope is medical products, vaccines, and technologies. The roles of pharmacists are not only limited to medical products, but also include vaccines and medical devices, especially those that demand special knowledge with regards to use and risk. Pharmacists, therefore, are responsible for ensuring the efficacy, integrity, and security of medical products, devices, and vaccines to safeguard a patient's health. Next scope is health services. Pharmacists hold the responsibility to deliver effective and safe and quality medications and services to achieve optimal health outcomes. Next is health workforce. Well-performing pharmacists are responsive to patients' needs and preferences. Involving patients in the healthcare decision-making process has shown a greater satisfaction and reduced complaints to offered services. Next is health information. Pharmacists are involved in health screening and surveillance programs like checking immunization status, detecting potential public health hazards, etc. With reliable and timely health information, pharmacists support the development of the public health system and collectively reduce risk to public health threats. So basically, a pharmacist does not only, as I told you earlier, he does or she does not only are into medicine dispensing or knowing the knowledge about medicine, but also other than that they are involved in various policy making, health policy making, various surveillance programs, screening programs, because they are having deep knowledge of disease as well as the drugs. Next scope is leadership and governance. Pharmacists take part in public health policy development, linking prevalence and drug utilization. Pharmacists enable development of effective health policies as well as they allow disease prevention. Pharmacists contribute to the emergencies in terms of designing response plans and protocols, and they contribute to resource mobilization through optimization of medication use and distribution. Moving on to the next slide. Role of pharmacist in public health. So these are the following roles which a pharmacist hold for the public health. First is review prescription, then dispense prescription or non-prescription medicines. Third is role is to provide patient counseling or education. Next is hospital and community pharmacy management, expertise on medications, proficiency on drugs or pharmaceuticals, entrepreneurship and leadership, deliver primary and preventive health care, professional, ethical, and legal practice, continuing professional development. So let's elaborate and go through these all roles in details. So first is review prescription. So as the name suggests, the first and basic role of a pharmacist is to go through the prescription that has been prescribed by the doctor, to receive it, to handle it in a professional manner, and to be able to check for their completeness and correctness. It's not that the pharmacist is only dependent upon the prescription information. If in case there's something incorrect, error, or incompleteness in the prescription, it is the role of pharmacist to check with the prescriber, to contact with him for any clarification and corrections in the prescription with suggestions if any. As soon as the patient reaches the doctor prescribes him different medicines and he goes to the pharmacist to purchase them. So it is the first basic and first role of a pharmacist to go through the prescription, to read it, and to dispense the medicines, and also to check the prescription whether it is correct or not. Next is, after reviewing, it is dispensing prescription or non-prescription medicine. So the pharmacist should be able to dispense the various scheduled drugs or medicines as per the implication of the Drug and Cosmetic Act and rules. So this Drug and Cosmetic Act and rules is it's a rule made in India for prescribing the drugs. Also, the non-prescription drugs, which is also known as over-the-counter drugs, should be dispensed judicially to the patient as required. So prescription drug means those drugs which have been prescribed by the doctor or by the physician, and non-prescription drug medicines are the OTC medicines, also known as over-the-counter medicines. These are those drugs for which we don't need a prescription by the doctor. So it's like basically for fever, cough, cold, etc. We just can directly go to the pharmacist and tell them that we are suffering from this so and so disease, so and so problems we are facing, and then as per our output, our input, the prescription, the pharmacist could prescribe the medicine for that, for which he does not need a prescription. So these drugs are called as over-the-counter drug or non-prescription medicines. Next role is to provide patient counseling or education. So pharmacists should be able to effectively counsel, educate the patients or the caretaker of the patient about the prescription or non-prescription medicine and other health-related issues. Effective communication includes using both oral and written communication skills and various communication techniques. Next role is hospital and community pharmacy management. So the pharmacy should be able to manage the drug distribution system as per the policy and guidelines of the hospital, pharmacy, good community practice, pharmacy practice, and the recommendation of the regulatory agencies. So whatever the drug regulatory affairs, the drug regulatory agencies of the country have been decided, the pharmacist should be only able to manage the drug distribution as per the guidelines. Also be able to manage the procurement, inventory, and distribution of medicine in hospitals or community pharmacy settings. Next is expertise on medications. The pharmacist should be able to provide an expert opinion on medications to healthcare professionals on safe and effective medications use and relevant policies and procedures based on available evidences. Proficiency on pharmaceutical formulation. The pharmacist should be able to describe the chemistry, characteristics, types, merits, demerits of both drugs and excipients used in the pharmaceutical formulation based on his or her knowledge and scientific research. So, Pharmacists should also be having a proficient knowledge about the pharmaceutical formulation. Formulation means be it syrup, be it capsule, tablet, ointment, whatever. The pharmacist should be knowing what chemicals are used in that, what are the chemical constituents, what are the characteristics, the use, the efficacy parameters, the effects, good effects, side effects, etc. of the drug, of the main chemical, as well as the excipient which has been used for preparing the formulation. Next role is entrepreneurship and leadership. The pharmacist should be able to acquire the entrepreneurial skills in the dynamic professional environment. Also, be able to achieve leadership skills through teamwork and sound decision making skills. Next role is to deliver primary and preventive healthcare. The pharmacist should be able to contribute to various healthcare programs of the nation, including disease prevention initiatives to improve public health. Also, to contribute the promotion of national health policies. Next role is professional, ethical, and legal practice. So, the pharmacist should be able to deliver professional services in accordance with the legal, ethical, and professional guidelines with integrity. Continuing professional development. The pharmacist should be able to recognize the gaps in the knowledge and skills in the effective delivery of professional services from time to time and be self-motivated to bridge such gaps by attending continuing professional development programs. Moving on to the next slide. Various dimension of health. So, what is health? As per WHO, which is World Health Organization, health is a state of complete physical, mental, and social well being, and not just merely the absence of disease or infirmity. Various dimensions of health. Dimensions as in various types of health. So, these are the following types of health. First is physical dimensions. Physical health dimension, it is defined as a state in which every cell, every organ is functioning at optimum capacity and imperfect harmony with the rest of the body. It refers to perfect functioning of body. It indicates that all body organs are structurally and functionally in a normal state and their organ and organ system. Smooth and easy coordinated movements are the sign of good physical health. Next is mental health dimension. Mental health has been defined as a state of balance between the individual in the surrounding world, a state of harmony between oneself and others, coexistence between the realities of self and that of other people and that of the environment. Next is social health dimension. Social well-being implies the quality and quantity of individual interpersonal ties and extend to the involvement with the community. Social health indicates harmony and integration within the individual, between individual and other members of the society. Next is spiritual health. Spiritual health is in this context refers to the part of individual which reaches out to find or for meaning of purpose in life. So these are all the various types of health or various dimensions of health. Moving on to the next slide, determinants of health. Health does not exist in isolation. So it can be influenced by many factors that lie within the individual and society. This factor interact and can promote or determinants the health of the individual or community. So the factors that influence the health is known as determinants of health. First is individual. Genetic and lifestyle comes under individual, while socioeconomic development, political will, availability of health services, and other factors come under the environmental factor. So let's discuss the first thing, which is genetic. Hereditary factor is one of the cause of certain disease, and the genetic characteristic inherited from parents are responsible for giving rise to some kind of ill health. For example, there are very great chances that the children of diabetic parents may suffer from diabetes. Moving on to next determinant, which is lifestyle. So the lifestyle affects in both the ways. That is, it may promote and maintain health, or it may adversely affect the health of the individual. So the individual's lifestyle is partly governed by the socio-cultural aspects, but he may learn lifestyle from his or her or others' experiences. For example, if health awareness is lacking, then habits like alcoholism, drug detrimental to the individual, but they may be a social problem endangering the addiction, may create problems in healthy living of an individual. Next is socioeconomic development. The development of a society plays an important role in getting rid from health hazardous customs and traditions. That's why improvement in economic, educational, and cultural sectors are collectively cause development of society. Next is political will. Poverty is the main reason of ill health. The poor people from living in slums lack good hygienic condition and are the target of disease agents. So people in rural areas who do not have access to health services and who cannot afford to pay for medical treatment are the victims of ill health. The policies framed and the implementation with the objective of maintaining and promoting health of these people can certainly affect the health status of the community. Next is availability of health services. Health is a fundamental right. Hence, it is important for each country to ensure that the people are healthy. The government of each country provides the healthcare services to its people at an affordable cost. WHO had set up a goal of achieving health for all by 2000. It has not been achieved, but the efforts are continuing. The essential components of primary healthcare limit identified by WHO were there should be adequate supply of water, safe water and sanitation. There should be promotion of food supply and proper nutrition, immunization against major infectious disease, maternal and child health care and family planning services, education of people about health problems and methods of preventing and controlling them, provision of essential drugs, prevention and control of locally endemic disease, appropriate treatment of common diseases and injuries. Other factors. Health is the issue that involves social, economic, political, cultural, educational, moral, nutritional, developmental, psychological, biological, occupational, spiritual, and many more aspects. All those factors that directly or indirectly affect these aspects determine the health status of individual and that of community. Moving on to the next slide, which is indicators of health. So indicators as in what indicates that a given community is healthy and how far a person should be called is a healthy person. So so as health is multidimensional, the health indicators too are many and varied. In describing the health status of the community, all factors that affect adversely the health must be examined and measured to answer the questions that are raised here. So the following indicators are mortality indicators, morbidity indicators, disability rates, healthcare service indicators, sanitation indicators, socio-economic indicators, and quality of life indicators. So let's discuss about each of these indicators in a detailed manner. Mortality indicators. Mortality means number of deaths that are indirect measure of health. Determining mortality rates in different age groups in a community, example, infant mortality rate, child mortality rate, maternity rate, disease-specific mortality rate, or crude death rate indicates the health status of the community. Determination of life expectancy is widely used as a major indicator of health status. Next is morbidity indicator, which is number of diseases. So it measures severity of condition endangering life. The morbidity indicator are used to describe ill health of those who are actually suffering from disease or illness. The morbidity indicators include epidemiological studies that determine incidence, which is the number of new cases of any disease in 1 year, and prevalence, that is the number of total disease of any disease, total number of cases of any disease till date. And the statistical data showing notification of disease, the number of admissions in the hospitals, etc. Next is disability rates. People who remain disabled for some time or long on recovery because of recovery or from illness or any disease. So nowadays, even restricted daily activity, example, too much bed rest, is considered as a disability. Disability rates are determined from limitation of mobility, means movement like walking, running, jogging, and limitation of basic activities. So there is event type indicators, which is like number of days of restricted activity or bed disability days, or work loss days within a specific period. Then next is person type indicators. This is limitation of mobility and limitation of activity. Next indicator which we'll talk about is healthcare service indicator. So the availability of healthcare service, measured in terms of doctor population ratio, population bed ratio, population health center ratio, etc., is used as indicators of health. Not only availability of healthcare services, but the extent to which these services are used. Tell us about the indication of health status. Next is sanitation indicators. Sanitation term covers care of food, water, disposal of excreta, which is waste product of body, etc., and regulation of environment. Thus, if adequate nutritional requirements are not fulfilled, it will result into ill health that can be measured in terms of height, weight measurements of school children, etc. The percentage of population with safe water and sanitation facilities and the measurement of air, water, noise, pollution, etc. are indicators which are used to measure the health status. Next is socioeconomic indicators. The measurement of socioeconomic development in terms of population growth rate, per capita income, level of unemployment, literacy rate, etc., is the indicative of socioeconomic health status of a community. Similarly, social and mental health problems like suicide, violence, alcoholism, drug abuse, etc., in a given community gives the indication about the social and the mental health. Last is quality of life indicators. Health status can be measured by describing the quality of life of the individual and whole community leads. Defining quality of life is difficult. The physical quality of life can be determined from infant mortality, life expectancy at age 1 to 5, and literacy. So these are all the indicators of health. Moving on to the next slide, which is Millennium Development Goal. MDG. So, in the year 2000, United Nations established the Millennium Summit and adopted United Nations Millennium Declaration. So, Millennium Development Goals (MDG) are identified and approved by 191 United Nations member states and 22 international organizations. Uh, the target date of achievement of these goals was identified to be 2050. So these were the following goals that were defined as identified as MDG. To eradicate extreme poverty and hunger, to achieve universal primary education, to promote gender equality and empower women, to reduce child mortality, to improve mental health, to combat with diseases like AIDS, HIV, malaria, and other things, to ensure environmental sustainability and to develop global partnership for development. Each goal has specific targets and dates for achieving those targets. The MDG was succeeded by Sustainable Development Goals in 2016, which we'll study in next slide. So, Sustainable Development Goals. The heads of state and government and high representative in September 2015 meeting in USA decided to on sustainable development goals SDG. SDG identified 17 sustainable development goals with associated targets. So these were the following 17 goals that were identified. The first goal is to end poverty in all its form everywhere, end hunger, achieve food security and improve nutrition and promote sustainable agriculture, ensure healthy lives and promote well-being for all at all ages, ensure inclusive and equitable quality education and promote lifelong learning opportunities for all, achieve gender equality and empower all women and girls, ensure availability and sustainable management of water and sanitation for all, ensure access to affordable, reliable, sustainable and modern energy for all, promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Reduce inequality within and among countries, making cities and human settlements inclusive, safe, resilient, and sustainable. Ensure sustainable consumption and production patterns. Take urgent action to combat climate change and its impact. conserve and sustainably use the ocean, seas, and marine resources for sustainable development, protect, restore, and promote sustainable use of terrestrial ecosystem, sustainably manage forests and combat desertification and halt and reverse land degradation and halt biodiversity loss. Next is to promote peaceful and inclusive societies for sustainable development and provide access to justice for all. Last goal is to strengthen the means of implementation and revitalization for global partnership and sustainable development. So these were all the slides from my end. Thank you so much. Thank you.